Well, a warm welcome to today's talk. It's Monday, the 21st of February. Now, the Prime Minister's just declared that all legal restrictions will end on Thursday for the pandemic. There's still advisory recommendations after that, but the legal restrictions will end on Thursday. Now, at the moment, there's about 1 in 25 people in the UK are currently infected with SARS coronavirus 2. And because of these easing of legal restrictions, I think we can safely expect those cases to go up for a period of time. I'm also expecting them to go up, in England at least, as a result of the increasing prevalence of Omicron BA2, which is more transmissible. Now, the good thing about ending these restrictions is there'll be more social interactions, therefore more people will be exposed to the virus, therefore more people will develop natural immunity on top of their vaccine-based immunity. The people we're concerned about is people that are completely unvaccinated who are naive to this virus and therefore will still have a level of risk, although in the UK we know that is remarkably small because about 98% or more of people currently have antibodies. And the other group of people, of course, are the clinically vulnerable, who do remain an area of concern, particularly those with significant immunocompromise. But the problem here is that we have data that people that have been guarding have still been getting breakthrough infections. So guarding in many people's situations has not been enough to prevent Omicron getting through. So I think everyone's going to be exposed to Omicron in the UK pretty well regardless of what you do. Sooner or later, it's just a case of when. And for me, my third vaccine, I should have checked actually, but it was 2-3 months ago, my third vaccine. So my level of vaccine-induced immunity is declining day by day. So my chances of getting ill and hospitalised with Omicron are less if I catch the virus today than if I catch the virus next week or catch the virus next month. And when I'm naturally exposed, that will boost my immunity. So that's roughly the thinking on this. Now, let's start off with Professor Spiegelhalter, David Spiegelhalter, Cambridge University. Now, Professor Spiegelhalter did hold it was a chair called the Public Understanding of Risk, and of course he's one of the leading statisticians in the country. And he's saying this: it's now time to start seeing the risk as similar to those we face from other viruses, which is absolutely true, and hazards we encounter in our lives. So I ride a push bike. That's a pretty dangerous thing to do. Cycling is a very dangerous activity. I ride a motorcycle, also a very dangerous activity, but I accept the risk because both of those things improve my quality of life. So this is sort of in that category. COVID has assumed what is called a dread risk. So this thing called a dread risk. And this means the mental and emotional toil of the pandemic means people overestimate the actual risks. So a lot of people are overestimating the risks now. We've kind of gone into not all of us, but some people have gone into kind of a bunker mentality, and we can't keep doing this forever. Well, we can, but life will be pretty boring. David Spiegelhalter, those feelings of dread make it challenging to accept a risk as something normal, to weigh it up in the way we all have to weigh up the inevitable risks of everyday life. So I agree. Now, Her Majesty the Queen is currently infected with COVID, and of course it will be Omicron infection that she has, because that's basically all the infections are Omicron now. Her Majesty is 95 and apparently is suffering from mild cold symptoms and able to carry on with light duties. I do hope I'm able to carry on with light duties when I'm 95. So it's worth remembering ourselves of the main, while we wish Her Majesty the speediest possible recovery, of course, but it is worth remembering reminding ourselves of the main features here. Now, this isn't bang up to date. These were as of a few weeks ago, but they haven't changed that much. Runny nose, headache, sore throat, fatigue, sneezing, persistent cough. These are the symptoms of the common cold. and we believe that this is what Her Majesty is suffering from, common cold type symptoms, but she has been diagnosed for Omicron. Of course, she's currently isolating as per the current legal guidelines, which don't change till Thursday. Going on, we'll just have a quick look through hoarse voice, chills or fevers, joint pains, fever, dizziness, brain fog, sore eyes, altered smell, muscle pains, lower back pain. It's a bit of an unusual one, lower back pain, but quite a few people are reporting that. Tim Spector had that, actually. Swollen glands, chest pain, skip meals, and Tim Spector seems to be quite well recovered now. And we're hoping to talk to Tim Spector actually this week on the channel. So, Her Majesty, we wish you all the best if you're watching, which I'm sure you're, well, you may be, who knows, who knows. Now, let's look at the situation in the UK as a whole. Now, here we have how immunity's changed. This is just a brief graph from mainstream media, but it is based on ONS data, so we'll accept it. And we see that here we have December 2020 and January 2021. So there's no comparison. These are the people with antibodies. So we see it's nearing 100%. It's about 98%. And of course, I wouldn't expect the antibody levels to go, and it's in all age groups, I wouldn't expect the antibody levels actually to go much beyond 98%, because because it is only tested to a particular threshold, and people that had the infection a year ago will no longer be having antibodies. And what antibodies mean to me, why this is important, is not because they have the antibodies, okay, that's good for a short period of time, but because people have got the antibodies, it means they've been exposed to the vaccine or the antigen, but that means there'll be some sensitization of memory B and T cells. What I would like to see from the Office for National Statistics is a clear breakdown between those that are unvaccinated and have been exposed to the virus, of which is about 8% of the UK population now, and the rest of the UK population which is vaccinated. That data, simply, I have never seen it. So that's a pity, but there we go. In the past year, basically, everyone's been exposed either to a vaccine antigen or to a actual viral antigen. So this is probably as good a time to release restrictions as any, while people still enjoy protection from their vaccines. Fewer COVID cases are resulting in death. And again, here we see number of deaths for every 1,000 cases. And cases are actually people who the Office for National Statistics estimate contracted COVID 4 weeks prior to the death occurring. Okay, so it's last 28 days. It's not the death certificate data that they normally use. Actually, it could be based on that. I'm not sure. Anyway, we can see it's gone down dramatically. So again, risk of death dramatically reduced. Why is this? Partly it's because Omicron is intrinsically less pathogenic, but mostly, by far mostly, it's because of the immunity that the community has built up. So there you go. A lot of people are overestimating the risk now, according to David Spiegelhalter. And even people that are immunocompromised, you could argue that they're best getting it 3-4 weeks after their booster dose of vaccine rather than 3-4 months after their booster dose of vaccine. That's my understanding of this. I'm not advising you what to do. It's my understanding of the science as I understand it. So Thursday the 24th, all COVID restrictions will end in England. Legal duty to self-isolate is going to stop free mass testing from April the 1st. Now, a bit more detail on that in a minute. So, Mr. Johnson, Prime Minister, today is not the day we can declare victory over COVID because this virus is not going away. We are entering into endemicity. He is correct. But it is the day when all efforts of the last 2 years finally enable us to protect ourselves while restoring our liberties in full. Yeah, I can agree with that. There were some other quotes that were more political, so I've skipped those. Omicron with falling cases and hospital admissions, and we could now complete, this is the Prime Minister again, transition back towards normality. Yeah, that makes sense to me, actually. And it's also going to massively improve herd immunity. while retaining contingencies to respond to a COVID resurgence or new variant should that occur. Okay, so he's not saying this is irrevocable. There's contingencies in place. Professor Sir Chris Whitty, Chief Medical Officer, the ending of the virus restrictions was a gradual, steady change over a period of time. I'm not sure that it was, actually. I think it's all going to be all of a sudden. Although you could argue it's been being eased for some time, okay, as the rates were declining. This is not a sudden everything stops. I think that's advice rather than a comment on reality. One day someone might analyse the effectiveness of the Chief Medical Officer during this pandemic. The public health advice would be for people with COVID to self-isolate to prevent others catching it. Well, I would have thought everyone is going to catch it, and I would have thought it's better for me to catch it while my immunity is still relatively high after my third booster dose of vaccine. So I'm not quite sure whether the Chief Medical Officer was thinking of me or not there or not. As would be the case for many other highly infectious diseases. Okay. Patrick Vallance, Chief Scientific Officer. The virus will continue to evolve over the next couple of years. Yeah, that's true. It will continually evolve. And there is no guarantee that future variants will be less severe than Omicron. That's true. But because Omicron is endemic, and if we're talking about guarantees, because Omicron's becoming endemic and people are constantly being reinfected, I would say it's fair to say there is a guarantee that that community immunity and herd immunity will be much higher, and the probability of any individual's immunity being much higher is much greater. So yes, there's no guarantee that we're not going to get new variants that could be more severe, but I think there is a guarantee we'll have better immune systems to meet it. So I think Sir Patrick there is saying that the glass is half empty rather than half full, but he's welcome to come on the channel and talk about it. From February the 21st, dropping guidance for education and childcare, twice weekly asymptomatic testing. Good, can't keep testing everyone all the time. Thursday the 24th of February, people who tested positive for COVID will no longer be legally required to self-isolate. This is the big change from the 24th of February. It's no longer a legal requirement. Still advised to stay at home and avoid contact with other people for at least a full 5 days is the advice. Routine contact tracing will end. So it's kind of gone on to advisory rather than legal. That seems to be what's happened basically. Fully vaccinated, close contacts, and those underage and those under age 18 will no longer be legally required to test daily for 7 days. Which, yeah, again, that makes sense. We've spent a fortune on testing, and if people aren't legally required to self-isolate, then, and of course, if people do self-isolate, all that's going to do is slow down the spread of the virus, which is going to reduce the rate at which herd community immunity is acquired. And it could also mean that people like me get the infection later when more of my immunity is worn off, which would concern me more. From April the 1st, free mass testing for symptomatic and asymptomatic for the general public will end. So free mass testing to end. There's still going to be targeted testing, which of course is a good thing. And this is the concern. We have to have a high index of suspicion for those that are vulnerable. And antiviral treatments such as Paxlovid can be prescribed for the vulnerable. Monoclonal antibody therapy can still be considered for the more vulnerable. And basically this is going to allow us to focus resources on the most vulnerable and the elderly who are going to become exposed to Omicron. But with the combination of the immunity from the vaccines, hopefully recent booster vaccination and early antiviral treatments, we can expect the outcome to be pretty good in most cases. But this does allow for focusing on the most vulnerable, which I'm pleased about. People with COVID symptoms will be asked to exercise personal responsibility when deciding to stay at home. So again, the emphasis here is we're still advising you to isolate. We're just not legally mandating it. which will just slow things down and mean that more people are going to be exposed a longer time after their booster doses. Guidance on COVID passports will end. Okay, fair enough. So I think we'll probably leave that there for now. The devolved administrations if you're watching in the States, the UK is somewhat balkanised at the moment. We have a little government in Scotland, a little government in Wales and Ireland and Northern Ireland and stuff. I think they're making decisions on this tomorrow, but they'll probably follow on. But they're free to mandate whatever they want to do. So this is a big step in the move towards endemicity. It's becoming endemic, and to me, this has to be done sooner or later. And personally, I think the judgment is probably about right, and that's not making a political comment. It's just my understanding of where we are in the move to the endemic status. So I think that's I think that's a pretty good news video, really. Thank you for watching.